and how my clients respond and the experience that I want them to have as they work with their trauma, because it's not easy. EMDR is an 8-step procedure that you're taken through for a disturbing memory or event. It has the word desensitization in its name, which means exposure to your traumatic experience. But the problem with trauma is that you're already exposed to your trauma every day through intrusive thoughts and intense feelings in your body that makes it like you're re-experiencing the trauma over and over. You're trying to get away from your trauma. You're trying to get away from your experience, not be forced to remember it. And whoever said that you need to remember to recover? No one, ever. OEI happens in the moment, so it gives us more flexibility to respond to what's actually coming up for you in a session. OEI was actually evolved from EMDR by Audrey Cook and my mentor, Dr. Rick Bradshaw, for trauma. It took what works from EMDR and it developed additional techniques based in neuroscience that are based in how the brain actually works. Because when the brain is overwhelmed by trauma, that experience doesn't go into memory like other memories. It's still in the emotional, that feeling, non-verbal part of the brain. And that's what you experience over and over. It's that feeling that you're in that experience. Trauma is experienced non-verbally and in the present tense. OEI gives us more flexibility to work with that here and now quality of trauma. EMDR follows a set of procedures, but not everyone can stay in that structure, especially if they get overwhelmed or shut down or with many traumatic experience. You can't even remember what happened because you're disassociated. And this is why the memory of trauma is fragmented. So it's hard to put into words. It's easier just to feel how you experienced it. And with OEI, we can adapt moment by moment in the present moment. You don't have to push through a process that you're not ready for, something that is freaking you out. We can pause, we can shift techniques, we can respond and be flexible in the moment. And isn't that what we're trying to do? We're trying to respond in life. We're trying to respond and be flexible. And so we focus on regulating the nervous system in the present moment. We don't focus on the past so that we can adapt to what you're experiencing in the present moment, in the session and in real life. We don't need to focus on the past. So we're just free to experience the what is of the here and now. And that is where you find access to freedom, right inside, right in the center of the present moment. One of the reasons I chose OEI in my practice is because you don't have to talk through painful personal memories. And that's helpful with trauma because trauma is hard to put into words because it hasn't been fully processed in that part of the brain yet. And we use visual pathways because visual pathways, using the eyes, is what I believe to be more effective than verbal pathways, like talking about trauma, because talking about trauma often makes it worse. It revivifies the trauma. And that's what they're trying to do in EMDR. They're trying to expose you to it and then desensitize you to it. But with OEI, we work directly with the eyes, with the body sensations, and whatever you're feeling in the present moment. And this is kinder and gentler than focusing on the past, because everything you need to heal is in the present moment. It's not in the past. OEI helps people feel safe. It's gentler. It allows you to stay present, which is what we're trying to do. Because when you disassociate from the pain and the trauma, you're also disassociating from the joy, the happiness, the connection that is available to you in the present moment. So when you're dissociated from all the bad stuff, you're also dissociated from the good stuff, all that good stuff that life is really about. So clients can feel positive shifts without being able to say why. Because the brain, when you give it the right conditions that we give it in OEI, it can do the work on its own. You don't have to verbalize it to experience those shifts. And you can notice the shifts happening in real life. They're subtle, but they're very clear. Those shifts as things move together and they integrate. And so that feedback in the present moment helps you trust the process. And that's what keeps me on track. That helps me know that we're going in the right direction. This is the integration that we're working for, because when things are integrated, you will start to feel like the past is in the past, that there's more distance between the past with every passing day. And you create space in the present moment, space for connection, for responsiveness, for regulation, for resilience. Because when we've experienced trauma, it's important to be kind and gentle to ourselves. Like, you don't have to beat yourself up because you're feeling hopeless, unmotivated, and you can't seem to do even simple tasks. That is the trauma, and you're not your trauma. It's not that you're not motivated, it's the trauma. And you are not your intrusive thoughts. You're not those uncomfortable, intense feelings in your body. This is memory of your trauma. OEI uses your brain's natural healing ability, and OEI has developed techniques and tools to access those healing pathways that are visual, not verbal. So people can feel safe in their bodies again, even after years of trying other approaches, EMDR, talk therapy, all those things that didn't work. Trauma is different because we always experience trauma in the present tense. OEI can help you heal your trauma even when nothing else has worked, because time doesn't heal all wounds. I'm not saying that OEI is better than EMDR for everyone. EMDR is so helpful for trauma, but I chose OEI because it fits the kind of experience that I want to give my clients. I want them to experience that kindness, that gentleness, the presence, being attuned to their needs and what they're actually experiencing, being flexible and responsive to the present moment. Because it's not about following a procedure, it's about meeting you where you are and helping you feel whole again, taking one small step at a time on a pathway that can actually get you to where you want to go. If you'd like to explore OEI accelerated with hypnotherapy and learn more about how this might work for you, let's connect. There's details in the description. Subscribe and like this video for more content on OEI and trauma therapy. Let me know if you've used EMDR or OEI in the comments and how it worked for you. And let's connect on the next one.